Let's now shift focus to a critical health issue affecting millions of women in Nigeria, and that is maternal anemia. A recent research project has made significant strides in addressing this challenge. The research project focused on the use of intravenous iron supplements to treat anemia in pregnant women and postpartum women. Health experts are hoping that NAFDAC will incorporate this IV iron used for the clinical trial in the treatment procedures of maternal anemia. Sarah Ayuku reports.
Iron deficiency anemia is a common condition in Nigeria affecting a number of pregnant women. Health experts are suggesting IV iron therapy as an effective treatment option for IDA, but its use in Nigeria is limited. They say IDA affects about 56% of pregnant women in Nigeria and increases the risk of maternal mortality, preterm birth, and low birth weight.
This is a worrisome condition that we need to address. And what we use to treat them basically is that we use oral iron, that's iron supplement to treat it. But we discovered that most pregnant women do not take this intervention. Why? Maybe because of the burden of taking this drug every day, or some do react to it. So because of that, most people don't use that drug. And at the same time, prevalence of this condition increases over time.
Maternal anemia is a public health concern globally, and Nigeria is no exception. This project focuses on addressing this issue through the use of intravenous iron supplement.
Typically in Nigeria, we have what's called information asymmetry, so such that the patients depend on the doctor's opinion on what is best for them. And when doctors are not familiar with, or healthcare workers generally are not familiar with a new treatment approach, they tend to have that resistance, which also translates to the patients. So this project was able to build confidence among the physicians and other healthcare workers.
The type that we used for this procedure, called ferric carboxymaltose, is not yet immediately available. It's only available under research conditions. The significance of this type of intravenous iron is that you can use it just once. All you need is just one dose, and it eliminates your iron needs.
One is cheaper than having to give blood. We know that we don't have a lot of blood available in our community, and a lot of people do not like to donate blood. Also, a lot of people do not like to receive blood. So it is cheaper than giving blood. You spend about 3 to 4 hours monitoring a woman on blood transfusion. The infusion with intravenous iron is about 15 minutes. However, it must be for women that are eligible.
The research shows that intravenous iron supplement can reduce maternal mortality by up to 30%. Sarah Ayuku, TVC News, Lagos.